I am Faisal Al-Buti and this is Madad Sina, a space for thinking carefully about healthcare, leadership, and how organizations behave. Not trends, not tools, but what actually works and why. Digital health is everywhere now. We hear about artificial intelligence, electronic health records, telehealth, and yet many healthcare systems still struggle with the same old problems they had years ago. That raises a simple questions worth asking. Are we really transforming healthcare? Or are we just adding technology to it? One thing I noticed over the years is that technology is rarely the real problem, and it is rarely the real solution. What matters more is how decisions are made. Digital health system challenges come down to three things. First, how data are used and not how much of it we collect. Second, how clinicians experience systems and not how systems look in presentation. And third, how leadership thinks about transformation, not how fast tools adopt it. In the United States of America, a large healthcare organization invested billions of dollars into a unified electronic medical record system. It worked, not because the technology was perfect, but because the leadership treated it as an organizational transformation, not an IT project. Around the same time, the UK's National Health Services attempted a national digital program. It's also cost billions, and it ultimately failed. What's interesting is that both had resources, both had technology. The difference was not a software. It was governance, decision-making, and how complexity was managed. In the GCC area, we have invested heavily in healthcare infrastructure and digital systems. That's a strength, but investment alone does not guarantee impact. What determines success is whether technology support clinical thinking, support decision making, support trust. These are not technical questions. They are a leadership questions. MadadSina exists to explore these questions calmly and honestly. This isn't about promoting solution, and it's not about criticizing systems. This is about understanding why certain approaches work and why others don't, especially in a real healthcare environment. If you work in healthcare as a clinician, an administrator, or a decision maker, these conversations matter. This is Madad Sina, and this is where we start thinking more carefully about healthcare transformation.